الحمد لله رب العالمين، والصلاة والسلام على أشرف المرسلين وعلى آله وصحبه أجمعين. Cancer, Non-Communicable Diseases, Epidemiology and Prevention by Professor Mahmoud Hani Suleiman. In this lecture, I will talk about epidemiology and prevention of cancer. Cancer definition: it is a neoplasm. The neoplasm is an abnormal mass of tissue, growth of which exceeds and is uncoordinated with that of normal. Exceeds and uncoordinated with that of normal tissues. Persists in same excessive manner after cessation of stimuli, which evoked the beginning of the change. Magnitude of the problem of cancer. Cancer is leading cause of death worldwide. It accounted for 7.4 million deaths, around 13% of all deaths in 2004. However, more than 30% of all cancer deaths are preventable. This is very important. About 1/3 of them are preventable either by prevention of cancer or by treatment. In most developed countries, cancer is second largest cause of death after CVD. Epidemiology found this trend emerging in less developed world. This is especially true in countries in middle-income countries. Problem continued. Already more than half of cancer occur in developing countries. Lung cancer kills more people than any other cancer. It is expected to continue till 2030 unless global tobacco control are greatly intensified. Some cancers are more in developed countries, as prostate, breast, and colon. In developing countries, liver, stomach, and cervical cancers more in developing countries. WHO celebrates World Cancer Day each year on 4th of February. Cancer in Egypt. Age standardized incidence rates per 100,000 were, in last survey, 166 for both male and female, 175 for males, 157 for females. So it is in Egypt more in males than females. Commonest sites in Egypt: liver, breast, bladder, liver for both sexes, bladder among males, breast and liver among females. By 2050, threefold increase in incident cancer relative to 2013 is estimated. Commonest cancers by site everywhere. Lung, commonest cancer in world among men. Breast, commonest cancer in world among women. Colorectal, then comes stomach, then cervix, prostate, and oral. Survival from cancer. Although breast cancer is second in incidence to lung cancer, it does not cause as much mortality because once diagnosed, it is amenable to appropriate interventions, which lung cancer is often not. So survival after breast cancer is more than after lung cancer. This is the survival rates in cancer. The most severe is the lowest one is lung. Lesser severe is stomach. Lesser severe is colorectal. The best for survival is breast cancer. Agent of cancer. A carcinogen is any substance, radionuclide or radiation, that is directly involved in exacerbation of cancer or in increase of its propagation. Physical carcinogens as ultraviolet ionizing radiation, chemical carcinogens as asbestos, this will be discussed in occupational diseases, components of tobacco smoke, aflatoxin, which is a food contaminant, arsenic in occupational diseases. It is found also in drinking water. Biological carcinogens as infections from certain viruses, bacteria, or parasites. Such agents are responsible for almost 1/5 of cancer deaths in developing world and 6% in industrialized countries. Carcinogens. For each disease on the left side column, there is a specific carcinogen. For leukemia, it is benzene. For all cancers, polycyclic hydrocarbons encountered in industrial and car exhaust, aromatic amines, those in a cigarette. For bladder, occupational exposure to asbestos, chromium, arsenic, and nickel cadmium, many carcinogens, especially lung, cobalt and X-ray dyes for skin cancers, that's found in food, ascorbate deficiency, predisposed to leukoplakia, increased saturated fat, breast and colon cancers, vitamin A deficiency, betel, areca for oral, esophageal, and colorectal cancer. Carcinogen continued. Tobacco, either in cigarette or in its various chewable forms, lung and oral cancers. Alcohol lead to liver cancers. Smoked fish lead to stomach cancer. Dietary fiber deficiency lead to colorectal cancer. Virus, hepatitis B and C for liver cancer, HIV and cytomegalovirus for Kaposi sarcoma, non-Hodgkin's lymphoma, Epstein-Barr virus, Burkitt lymphoma, nasopharyngeal carcinoma, human T lymphotropic virus for T-cell leukemia, human papilloma virus for cervix, parasites schistosoma for bladder cancer, fungal toxin, aflatoxin, which is produced by the fungus Aspergillus flavus, growing on stored grains, nuts, and peanut butter for liver cancer. Cancer etiology. Tobacco. This is the most important part, and this is the most important part to be worked on for prevention of cancer. Tobacco use is the single largest preventable cause of cancer and some other disease and premature death. Use of tobacco is responsible for about 21% of all cancer deaths worldwide, which is more than all other known causes of cancer combined. Tobacco increases the risk of cancers of lung, oral and nasal cavities, esophagus, stomach, liver, pancreas, kidney, bladder, cervix, and myeloid leukemia. Tobacco continued. The coming table outlines importance of cancer prevention through eliminating smoking in populations. In addition to major cancer sites mentioned above, for which is tobacco is the responsible, evidence implicates cigarette smoking as a contributor to risk of colon and rectal cancers. There is little or no evidence of an association with cutaneous melanoma and conflicting evidence for prostate cancer. This table shows the estimated proportion of cases that can be prevented in absence of tobacco use. We call in epidemiology population attributable risk percent. estimated per year number of deaths worldwide and in US due to tobacco. The first two columns are for worldwide smoking population attributable fraction. That is the part if smoking is prevented, this percent from this is due to this cancer will be reduced. So 2001, this is worldwide for lung and bronchus cancers are 856. 70% of them will be prevented if we prevent smoking, and so on. For oral cavity cancer, 42% will be prevented. For esophagus cancers, 42 will be prevented. Bladder, 28 will be prevented. Pancreas, 22. Liver, 14%. Stomach, 13%. Leukemia, 9%. Cervical uterus, 2. For all cancers, about more than 1/5 will be prevented from disease due to these all cancers. The same is done for the US. Okay, according to this table, worldwide more than 1/5 of cancers deaths will be prevented, and about 1/3 of cancers will be prevented in US if smoking is prevented. Second-hand smoke and environmental tobacco smoke also significantly increase the risk of lung cancer. Second-hand smoke contains more than 50 carcinogens, and there is no risk-free level of exposure. This is very important. No risk-free level, even small amount. Separating non-smokers from smokers, ventilating buildings, and cleaning air cannot eliminate exposure of non-smokers. Only eliminating smoking in indoor spaces will do so. Alcohol and cancer. Risk of several human neoplasms is associated with alcohol, especially for cancer of liver, oral cavity cancer, esophagus cancer, and breast cancer. Risk of hepatocellular carcinoma increase. This is due to rapid degeneration of liver cells in alcoholics. Risk is increased for squamous cell carcinoma of buccal cavity and pharynx and esophagus. Supraglottic larynx. Most studies show effect of smoking on risk of these tumors to be greater in drinkers than in non-drinkers. Alcohol continued. Alcohol increased these neoplasms greater in malnourished. In US, alcohol and tobacco account for about 80% of these cancers. Adenocarcinoma of lower esophagus, gastroesophageal junction, and gastric cardia are associated with alcohol use. For example, 50% of all cancer deaths worldwide and 4% of cancer deaths in US attributed to alcohol use. These are some occupational causes of cancer. Why we mention them? Because if you see a patient is exposed to one of these, you can look for these cancers. And if you work in a place where one of these chemicals are present, you can expose one of these cancers. So for bladder cancer is 4-amino biphenyl. For lung and skin cancer, arsenic and arsenic compounds. For lung cancer and mesothelioma of pleura, asbestos. For benzene leukemia, for benzidine bladder, beryllium, lung cancer, bis ether and chloromethyl ether. For lung, cadmium and cadmium compounds lung, chromium compounds lung, and sinonasal ethylene oxide leukemia and lymphoma, formaldehyde nasopharyngeal cancer, mustard gas, which is sulfur mustard, lung and larynx cancer, and so on. Skin cancers on all of these, coal tar pitches, coal tars, mineral oils, shale oils, soot, and wood dust, sinonasal cancer. These industrial processes with exposure circumstances can lead to cancer. All this is a small number of exposures. I put it here. The list is more than this. If you have a patient working in one of these, you can expect these cancers. Aluminum production, lung, bladder, lymphosarcoma, and reticulosarcoma. These are cancers present if work in aluminum production. Manufacture of Oramine, bladder, boot and shoe manufacture, nose and bladder, coal gasification, lung, bladder and skin, coke production, lung, bladder and skin, furniture, nose, cancer, hematite mining, which it is the ore of iron, underground with exposure to radon, lung cancer, occupational exposure to strong inorganic acid mist containing sulfuric acid can lead to lung, larynx, and nasal sinus cancers, iron and steel founding, lung cancer, isopropyl alcohol manufacture, strong acid process, nasal sinus, manufacture of magenta, bladder, painters, lung, larynx, esophagus, stomach, bladder, leukemia, lymphoma, cancers. All these can be in painters, lung, larynx, esophagus, stomach, bladder, leukemia, and lymphoma. Rubber industry can lead to bladder and leukemia. Of course, not all those working in these industries, you will find the cancer in them, but a good proportion of them can have these cancers if the preventive measures are not done. If the preventive measures are done, it is reduced very much. Environmental pollution and cancer. A recent report estimates 5% of lung cancers worldwide are attributable to urban air pollution. This risk rising to 7% in low and middle income countries. Host factors. Age. Aging is a fundamental factor for development of cancer. Incidence of cancer increases dramatically with age due to build-up of risks for specific cancers that increase with age. Rising incidence of cancer is partly due to increase of life expectancy. 6. Some cancers are male, like oral cancer, lung cancer, esophagus, stomach, bladder, and some are female, breast and cervix. This is very obvious. Genetic factors associated with some cancers. A blood group associated with increased stomach carcinoma, Down syndrome increased with leukemia, other genetic cancers, polyposis coli and retinoblastoma. Cancer prevention. Primary prevention, first, as we said before, is tobacco, then alcohol. Control of tobacco and alcohol consumption by health education, legislation against smoking and against alcohol, restriction of smoking in public places, a comprehensive strategy including bans on tobacco advertising, a sponsorship, tax increase on tobacco, and cessation programs can decrease tobacco consumption. Some countries like Norway developed ambitious plans to eliminate smoking among all the people. Primary prevention of cancer continued to maintenance of personal hygiene to prevent HPV infection and carcinoma of cervix. We give lesson on HPV virus. 3. Decrease radiation exposure, especially with unnecessary X-rays done. Provide personal protective equipment to workers. Look occupational radiation in radiation plants or radioactive mines. Decrease occupational exposure to carcinogens through engineering measures and PPDs. This will be discussed in detail in occupational diseases. Primary prevention of cancer continued. Immunization against hepatitis B using hepatitis B vaccine is now national immunization schedule. The human papilloma virus vaccine is now being used against HPV infection. Legislation and surveillance of food additives, drugs, and cosmetics that may lead to cancer. Control of air pollution. Treatment of precancerous lesions like cervical tears, polyposis, genital warts, chronic gastritis, chronic cervicitis. Motivate people to recognize early signs of cancer and seek treatment, which is called cancer education. Danger signs to be used in health education to educate people about them so they treat cancer early. Lump or hard area in breast, sudden change in previous wart or mole, persistent change in bowel habit like constipation, diarrhea, or bleeding, persistent cough, hoarseness of voice, increased menstrual blood loss or menorrhagia, blood loss from any natural orifice, swelling or sore throat that does not heal, unexplained weight loss. All these are danger signs that we teach people about them so they seek medical advice early. Secondary prevention of cancer. Cancer registration. Hospital-based registry, population-based registry. Registration of cancer cases will help us to study it and know the epidemiology and do diagnosis and treatment from evaluation from hospital registers. Population-based registry, optimum population size is 2 to 7 million, optimum population for registry. It provides incidence tools to initiate epidemiological inquiries, surveillance of time trends, planning and evaluation, planning for prevention. Early detection by screening. Cancer screening is possible due to precancerous lesion lasts for long periods before turning on cancer. All cancers begin as localized growth before spreading. Majority of cancer occur at accessible sites like skin and mucous membranes. Methods of screening: mass screening, multi-site or single site. Based on existing evidence, mass population screening can be advocated only for breast and cervical cancer using mammography screening and cytology screening in countries where resources are available for wide coverage of population. Selective screening of risk groups, treatment, surgery, radiation, and chemotherapy. Tertiary prevention, analgesia, rehabilitation after amputation or laryngectomy, colostomy, facial surgery. وبهذا أقول الحمد لله رب العالمين و thank you for your good listening.